Hello and welcome back to Medical Videopedia. Here are the 7 symptoms to pay attention to that could indicate that you have vitamin B deficiency. Number 1, fatigue and difficulty concentrating. If you're low in vitamin B12, you're likely to feel fatigued. Your body's cells need vitamin B12 to function properly. People with a low B12 level may feel foggy-headed or have difficulty concentrating and completing tasks. Older adults are especially at risk for these specific side effects. In fact, many studies have associated low B12 with worsened mental function, specifically in older adults. Fortunately, studies show that mental impairment related to low B12 levels can improve with B12 treatment and supplementation. For example, a 2020 study gave 202 people with mild and mental impairment or low normal B12 levels a replacement therapy for 3 months. And after treatment, 84% of the participants reported significant improvement in their symptoms. Number 2, headaches. Vitamin B12 insufficiency and deficiency can cause and lead to neurological side effects, including headaches. In fact, headaches are among the most commonly reported symptom related to B12 deficiency in both adults and kids. Some studies have shown that people who frequently experience certain types of headaches are more likely to have low B12 levels. A 2019 study with 114 people, half of whom experienced migraines, found that the blood levels of B12 were significantly lower in participants with migraines compared to the participants with no migraine history. This study also found that those with the highest B12 levels were 80% less likely to have migraines compared with participants with the lowest B12 levels. Research continues to investigate the treatment with B12 and how it may improve migraine and headache symptoms in some people. Number 3, depressive symptoms. B12 is essential to the proper functioning of your central nervous system, and a deficiency in this nutrient can impact your mental health. Specifically, B12 deficiency is associated with a greater risk of developing depression. Having low levels of B12 can cause elevated levels of a sulfur-containing amino acid called homocysteine. In turn, this may contribute to the development of depression by increasing oxidative stress, DNA damage, and cell death to the body. A 2020 study with 132 children and teens, 89 with and 43 without depression, found that participants with depression had lower B12 levels and higher levels of the homocysteine compared to those without depression. In addition to depressive symptoms, low or deficient vitamin B levels may lead to other mental conditions, including psychosis or mood disorders. Number 4, gastrointestinal issues. A vitamin B deficiency may also cause diarrhea, nausea, constipation, bloating, gas, and other gastrointestinal symptoms. These issues can affect both adults and children with vitamin B deficiencies. Keep in mind, though, that these symptoms are nonspecific and could be caused by many other factors. For example, food intolerance, medication, infections, or anything else which may lead to upset stomach. Number 5, pain and inflammation to the mouth and tongue. Glossitis is a medical term that refers to inflamed, red, and painful tongues. It can be caused by a B12 deficiency. In people with this deficiency, glossitis can appear alongside other conditions that are characterized by sores and inflammation in the mouth. Even though glossitis and other conditions are very common in people with B12 deficiency, it can also occur and be caused by deficiencies in other nutrients like folate, riboflavin, and niacin. Number 6, paresthesia in your hands and feet. Paresthesia is a medical term that refers to burning or a, quote, pins and needles sensation in certain areas of the body, like your hands and feet. Many adults and kids who have a vitamin B deficiency report experiencing paresthesia. Unfortunately, this symptom of vitamin B12 deficiency overlaps with symptoms related to diabetic neuropathy, nerve damage caused by high blood sugar that can cause pain and numbness in the extremities. Furthermore, people with diabetes who take metformin are at higher risk of developing B12 deficiency because this medication can reduce vitamin B12 absorption in the body. So, a vitamin B deficiency could be misdiagnosed as peripheral neuropathy in people with diabetes. And as a result, many experts recommend that people taking metformin regularly get screened for a vitamin B deficiency to prevent misdiagnosis. Number 7, pale or yellow skin. Another sign that can indicate vitamin B12 deficiency is having pale, yellow, or miscolored skin. B12 deficiency can also cause a condition called jaundice, which makes your skin and the whites of your eyes take on a yellowish color. The color is caused by high levels of bilirubin, which is a waste product created when your body breaks down red blood cells. Last but not least, some other signs of vitamin B deficiency may also include muscle cramps, muscle weakness, impaired coordination, erectile dysfunction, and vision disturbances. B12 deficiencies can even cause vision disturbances, possibly due to damage in your optic nerves. Again, if you're experiencing any of the symptoms listed in this video, it's important to discuss them with your healthcare provider. Thanks for watching. Please like, comment, and subscribe if you feel this information has helped you in any way. Please feel free to share this video with your friends, family, or anyone else that you may feel like may benefit from this information. Talk to you again soon.